What are aerosol generating procedures in dentistry? This is in the modern times and during the COVID pandemic. AGPs or aerosol generating procedures are medical or patient care procedures that produce airborne particles known as aerosols. These are generated by high-speed instruments working in the mouth.
Aerosols are suspensions of fine solid particles or liquid droplets found in air or another gas. These vary in size and may contain viruses, bacteria, or fungi. Aerosols, in the dental setting, are usually a mix of air and water derived from dental devices and the patient's saliva. Production of aerosols should be controlled as there is a risk of infection transmission when these aerosols become suspended in the air or fall as tiny droplets in surfaces.
AGPs can create a risk of airborne transmission of infections that are usually only spread by droplet transmission. Hence, healthcare professionals are really advised to be careful of this.
Most aerosol generating procedures in the dental setting involve removing small pieces from the teeth and its surfaces. Routine restorative procedures that use high-speed hand pieces also produce a high amount of aerosols. Procedures that use high-pressure 3-in-1 syringe can also produce airborne bacteria with amounts as high as those produced by ultrasonic scalers. Some dental aerosol generating procedures include use of cavitron, piezo-sonic, or other mechanized scalers. In the dental practice, ultrasonic and sonic scalers are considered to be the greatest source of aerosols. Procedures using slow-speed drills, such as surgical drills, may also produce aerosol particles smaller than 5 micrometers. Aeroabrasion or intraoral sandblasting also produces aerosol. Aeroabrasion is a drill-less technique that uses an instrument like a mini sandblaster to spray away small areas of tooth decay.
Especially during this pandemic, dental practice shall adhere to strict guidance and infection control procedures to ensure the patient's and staff safety at all times. Here are ways on how to reduce the risk of AGPs. Avoid AGPs whenever possible, unless strictly necessary. Always wear the full advised personal protective equipment or PPEs for the clinical staff and of course for the patients, and always follow precautionary measures. Allow an appropriate fallow time after an AGP treatment has been performed. This is where the empty surgery is left undisturbed for aerosols to settle. Use high volume evacuators or HVE. Also, increase ventilation by having doors and windows open to help virus killer ventilation, and also invest in air filtration systems. And of course, screen the patients thoroughly regarding COVID-19 status. This is the most essential part right now.